this is Dr. Emma Nichols, and this is the latest information on US FDA approvals for May 20th through the 31st, 2024. And it was Memorial Day last week, so I took a little day off, and I hope you enjoyed your Memorial Day also. But I'm capturing all the FDA approvals that have happened for the last couple of weeks. All right, so first up this week, the FDA has approved mRNA 1345 called mRESVIA for the prevention of lower respiratory tract disease caused by respiratory syncytial virus, RSV, in adults aged 60 years and older. This marks mRESVIA as Moderna's second approved product following its COVID-19 vaccine, and it is the first RSV vaccine available in single-dose pre-filled syringes. mRESVIA utilizes an mRNA sequence encoding a stabilized pre-fusion F glycoprotein, which is crucial for viral entry into host cells and is a key target for neutralizing antibodies against RSV. RSV is a significant cause of lower respiratory tract infections and pneumonia, particularly affecting infants and older adults. In the U.S., it leads to 60,000 to 160,000 hospitalizations and 6,000 to 10,000 deaths among older adults annually. The approval was based on results from the Phase 3 CONQUER-RSV trial, which involved approximately 37,000 adults aged 60 years or older across 22 countries. The trial demonstrated a vaccine efficacy of 83.7% against RSV lower respiratory tract disease, with a median follow-up of 3.7 months. Longer-term analysis showed continued protection over a median follow-up of 8.6 months. The most common adverse reactions included injection site pain, fatigue, headache, myalgia, and arthralgia, with no serious safety concerns identified. The approval of mRESVIA was granted to Moderna, Inc. Also last week, the FDA approved lisocabtagene maraleucel, also called lisocabtagene or Breyanzi, for the treatment of adult patients with relapsed or refractory mantle cell lymphoma, MCL, who have received at least 2 prior lines of systemic therapy, including a BTK inhibitor. Breyanzi is a CAR T-cell therapy that involves genetically modifying a patient's T-cells to express chimeric antigen receptors, CARs, that specifically target tumor antigens. Mantle cell lymphoma is a rare and aggressive form of non-Hodgkin lymphoma that often has a poor prognosis, especially in relapsed or refractory cases. The approval was based on data from the MCL cohort of the Phase 1 transplant-ineligible trial. In this study, patients with relapsed refractory MCL who had received at least 2 prior lines of therapy, including a BTK inhibitor, showed an overall response rate of 85.3%, with a complete response rate of 67.6%. At a median follow-up of 22.2 months, the median duration of response was 13.3 months, with 51.4% of responders still in response at 12 months and 38.8% remaining in response at 18 months. The approval of Breyanzi was granted to Bristol Myers Squibb. Also last week, the FDA accepted the Supplemental Biologics License Application, sBLA, for isatuximab, also called Sarclisa, in combination with bortezomib, lenalidomide, and dexamethasone, also called BRD, for the treatment of transplant-ineligible newly diagnosed multiple myeloma, NDMM. Sarclisa is already approved for relapsed refractory multiple myeloma, RRMM, in combination with pomalidomide and dexamethasone, and in combination with carfilzomib and dexamethasone, making this its 3rd potential indication. Sarclisa is a monoclonal antibody targeting the CD38 receptor on multiple myeloma cells, inducing anti-tumor activity through apoptosis and immunomodulatory mechanisms. Multiple myeloma is a hematologic malignancy characterized by the proliferation of malignant plasma cells. It commonly affects the bone marrow and can lead to bone pain, anemia, and renal impairment and hypocalcemia. The approval was based on the IMROZ Phase 3 study, which demonstrated a significant improvement in progression-free survival for patients treated with Sarclisa in combination with VRD compared to VRD alone. The FDA has granted priority review with a decision expected by September 27, 2024. The review emphasizes the potential of Sarclisa to address unmet needs in multiple myeloma. The approval of Sarclisa was granted to Sanofi. And now a word from the supporter of this podcast, Nascent Medical. Is your internal medical writing team tapped out? Nascent Medical is here for you. Our team of native English-speaking MD and PhD level medical writers specializes in providing fast turnaround needs assessments, carefully annotated manuscripts, engaging slide decks, and accurate ad-board summaries in any medical specialty. Just visit nascentmc.com now and get a speedy estimate. That's nascentmc.com. Just in case you didn't get that, that's nascentmc.com. Also last week, the FDA approved clonidine hydrochloride, also called Onyda XR, for the treatment of attention deficit hyperactivity disorder, ADHD, in pediatric patients aged 6 years or older. Onyda XR is the first approved liquid non-stimulant ADHD medication. This once-daily extended-release oral suspension designed for nighttime dosing can be used alone or as an adjunctive therapy to FDA-approved stimulant medications. Clonidine hydrochloride, or Onyda, exerts its therapeutic effects through its action as a sympatholytic agent, which decreases sympathetic outflow from the central nervous system. ADHD is a common neurodevelopmental disorder that can impact attention, impulse control, and activity levels. The need for a range of therapeutic options is essential, as individual responses to medication can vary significantly. The approval of Onyda XR was granted to Tris Pharma, with the availability expected in the second half of 2024. Also last week, the FDA approved eculizumab AEEB, also called BCAM, as the first interchangeable biosimilar to eculizumab, also called Soliris, for the treatment of paroxysmal nocturnal hemoglobinuria, PNH, or atypical hemolytic uremic syndrome, also called aHUS. Eculizumab AEEB, a monoclonal antibody, targets the complement C5 protein in the immune system's complement cascade. By binding to C5, eculizumab AEEB prevents the breakdown of red blood cells. This mechanism helps treat PNH and aHUS, both characterized by the breakdown of red cells, which often lead to adverse results such as anemia, thrombosis, pancytopenia, and thrombocytopenia. The approval was based on findings from clinical trials which showed that eculizumab AEEB has the same safety warnings and is expected to have the same adverse reactions as the eculizumab. The approval of eculizumab AEEB was granted to Amgen, Inc. This is the 53rd approved biosimilar in the U.S. Also last week, the FDA approved a new one-pill, once-daily tablet administration option for deuterbinazine, also called Austedo, a medication for tardive dyskinesia and chorea associated with Huntington's disease. Deuterbinazine, a vesicular monoamine transporter 2 or VMAT2 inhibitor, is now available in 4 tablet strengths, 30, 36, 42, and 48 milligrams, expanding its original dosing options of 6, 12, and 24 milligrams. The latest approval of deuterbinazine was granted to Teva Pharmaceuticals. All right, that's it for this week. Thank you so much for checking this out. If you're interested in some free downloads for medical writers and editors, go to learnamastyle.com. That's learnamastyle.com. And also, if you need a medical writer for your company, or you want to refer us, or you're a freelancer and you've got too much work on your plate, just check us out at nascentmc.com. That's nascentmc.com. All right, I'll be back next week. Have a wonderful week. Thanks so much.